Hello friends, welcome to Friend of Health, a complete channel on homeopathy. When we say a complete channel on homeopathy, you might be feeling majority of our videos were regarding the competitive exam guidance and competitive exam related questions, its discussions, etc. But always we wanted, as we promised in the very first video of this channel after the launching, regarding the playlist, we had created a video. So what all we are expecting to do in this, or what all we dream to do in this channel. So there were like the conversation where we will be talking to eminent doctors, homeopaths who are doing very well in this system and contributing to the system academically and clinically. So that was one of our dream, and we wanted to or wish to travel to places where wonderful homeopathy practice is going on, some colleges which are exceptionally very well in the field of homeopathy. All these are our dream. Because of COVID and all, we couldn't travel and all, but definitely we will be coming up with such useful things, interesting things for homeopaths in this series, a kind of lecture series which we are starting now, especially in the subject of organon and philosophy, where we are planning to bring eminent doctors, passionate homeopaths who will come and speak regarding some basic topics, some basic ideas they will give, and which will ignite our thought process, and the perception of the writings of the geniuses like masters like Hahnemann, Boninghosen, Kent, and all the latest modern trends in homeopathy. When they come and speak about that, we'll get a kind of more idea regarding the system, and the passion to the homeopathic field will definitely come only through the understanding and interest you show in organon, I feel. So today I have an eminent personality, a very passionate homeopath who loves philosophy, who loves research, who loves the science of homeopathy, Dr.Jerald Jeyakumar. So let me introduce him to my audience, and after that he will take a presentation, an academic class regarding a very interesting topic, a very controversial topic. Controversial in the sense there are a lot of authors or people who have already done that topic, but we are following it, and there are some errors in that. So after this video you may feel okay, this point I am not agreeing, or this point I agree. Please do express your agreement or disagreement regarding this presentation in the comment section of this video, so that the next interactive session based on this video will be for us, these comments we can address it. So every student of organon, every passionate homeopath who loves the guidance from our master can watch this video fully, patiently, and take notes, write down whatever he is presenting, and come up with your doubts and questions. So the topic will be the classification of diseases, and let me introduce Dr. Jerald Jeyakumar. Dr. Jerald Jeyakumar A, BHMS MD. Currently working as Government Medical Officer, Department of Ayush Homeopathy, Government of Kerala at Wayanad District. He is also the district convener of Sadgamaya, a pediatric psychosocial project under Department of Homeopathy, Kerala. Completed BHMS from Father Homeopathic Medical College, affiliated to Rajiv Gandhi University of Health Sciences, Bangalore in 2004, and post-graduation is completed in Homeopathic Philosophy from Government Homeopathic Medical College, Kozhikode, affiliated to University of Calicut in 2009. He worked as a guest lecturer in the Department of Practice of Medicine at Government Homeopathic Medical College, Kozhikode during the year 2009-2010. Worked as NHM Medical Officer at Government District Homeo Hospital, Kozhikode 2010-2014. Secured state first rank in Tamil Nadu PSC and worked as Assistant Medical Officer Homeopathy at District Hospital Udagamandalam, Nilgiris during 2014 to 2016. Currently working as Medical Officer under Government of Kerala at Wayanad since 2016. His fields of expertise are like as a resource person in disaster management and palliative care, and the fields of interest are homeopathic philosophy and pediatrics. He was academically excellent. Organ of medicine and philosophy in his PG 2009. He came out with a first rank in the Calicut University. I would like to thank Dr. Jerald Jeyakumar for accepting our invitation. And after our talks and discussions regarding this organon subjects, organon topics, some of the doubts, while talking about that, I felt he must come and talk to our audience, friend of health audience. So thank you once again for accepting our invitation. And please start with your presentation. And after that, I will be asking whatever doubts or any clarity if it is needed regarding the topic. But definitely this presentation or lecture series will continue, and it will be complete only by your doubts when it is addressed. So he will be open for discussion in the coming videos, so you can put your all doubts in the comment section of this video. So we'll start with the presentation.
Okay. Thank you, Dr. Saleh, and dear friend of health. Have a very good evening to everybody. This presentation, what I'm actually going to do is about classification of diseases, which I did back in my when I was doing my post graduation in Government Homeopathic Medical College, Calicut. It was back in 2007, and almost 15 years after that, I am actually presenting this presentation. And the necessity of this presentation came after a discussion with Dr. Salih. Actually, he's my brother, my junior in Father Millers. And when we had this Organon discussion, and we felt like Organon has been misunderstood or even not properly discussed at many places. And Organon is as always, I feel like it is an instrument of thought. And we know the definition. So we need to have some thinking, we need to have some discussions. Then only this philosophy actually enrich our mental capacity. And it actually not only about our academic aspect, but also in our daily life and also in our homeopathic practice. So without much description, we let us go to the proper topic, classification of disease. As I said, we actually know about classification. This is the what we say the fundamental of homeopathy, the fundamental of approach of or the practice of Organon or practice of homeopathy. So right now I am working as a government medical officer in Kerala. I am a Organon PG, and during that time we had these kind of debates in our college time as well. So Organon actually every year when we study when doing a BHMS or when we study in PG, it gives you different perception. But once you come into your practice and the age by age when you advance, and it gives you new perspective about what actually Hahnemann said. And that's why I feel like Organon is rightly called as Holy Book of Homeopathy. Like every religion, every philosophy has its own kind of holy book. And when we see, even when we study Mahabharata, when we study even Bhagavad Gita or Bible or Quran, when we study in our childhood age, it has one perception. But when we grow up, it has another. When we come to an adult life, in a little older life, when you see the perception about that particular same philosophy changes. Similarly, when you study Organon, when you study during your college time, and when you do it in your practice, and definitely the perception and the application level, it is actually changing. So it depends upon its own perception and its own personal experience. So I left it to the audience, like how you take Organon, how I am going to say, this is not an ultimate, this is my understanding and this is my perception. And I'm happy to share my understanding and my level of experiences with you. So we'll go into the slide. And every presentation, whatever I do it as my always a tribute to our master. And this presentation exclusively to our master and Samuel Hahnemann. And before entering into the Organon proper, let's see the general aspects of classification. So the definition comes like this. It is a grouping of facts and phenomena according to their resemblances and differences to serve some purpose. You see, classification is very basic. Like in any science or any phenomena, anything, there is a classification. My knowledge about classification, it starts from something 4,000, 5,000 years before in Tamil. There is a classification about land, forest, hill region, and agricultural land, desert land, and seashore land, which is called as Kurinji, Mullai, Neidal, Palai, and Marudam. Such kind of classification is happened in old about 4,000, 5,000 years about the land. So such classification is there existing everywhere. In another aspect of politically, we see there is a caste system classification, there is a religion classification. Everything has some kind of classification. So classification is a basis of human nature, or it is a basic cognitive process. Okay, and so what is the purpose? It extends our depth of knowledge. It helps us in understanding the facts of nature, and also it helps us it helps in our memory. It is an easy aid for our memory. Systematization of any branch of human knowledge presupposes classification. So the classification is a very basic phenomenon, basic thing. So in connection with homeopathy, what we can bring, there are historical perspectives of classification. So as we all know, when we study science, we know about these great people, right from Carl Linnaeus and Georges Cuvier. So Carl Linnaeus is the person we know this Linnaean system of classification of the nature itself. But whether it started from Linnaeus, because we know everything is now connected with Linnaeus, but it has started from the period of Socrates, followed by Aristotle and Plato. All have their own kind of classification. So Carl Linnaeus classification is a dominant classification, and then later many people have given their additions and modifications. And these are the people like Carl Linnaeus, Georges Cuvier, and John Ray. These people are the pioneers of classification of natural order. But in medical sense, we can see about Hippocrates and Galen. They have classified something called as constitution and humors. According to them, they have classified blood, phlegm, black bile, and white bile or yellow bile. They have classified that. And the original classification actually about the natural order or the botanical classification, it starts from Theophrastus. He's a Greek botanist, and he's also called as father of botany. Okay, so this for a historical aspect. But this particular classification we very well know about our periodic classification in chemistry we do. So something we learned about biology, something we are learning about chemistry as well. So why I kept these two slides? Because now actually homeopathy has taken two very different shapes. Right now we have seen we are actually understanding remedies in different perspectives. One of the most common perspectives, understanding through classification through kingdoms. We study patients, also we study drugs based on our plant kingdom, in that animal kingdom and medical kingdom, like that we classify. So this will give you an idea of classification, how it is very important. So now this has taken, the classification has taken different shapes, different dimensions in homeopathy. Just to brush up your history or your science class. So towards classification of diseases improper. The classification of diseases happened from old time. Now we are now strictly talking about the Western system of medicine and the classification, because Ayurveda and Siddha and Chinese medicine and Unani, they have their own classification of diseases. But when we strictly talk about homeopathy, which is having a Western origin, let's talk about the historical perspectives of classification of diseases from the Western origin. So the known first classification comes in psychiatric diseases is from Hippocrates, followed by some of the renowned people, that primarily Felix Platter. He was the first person to classify psychiatric illnesses. He was a Swiss physician. But later it was also followed by Thomas Sydenham. He is also called as English Hippocrates. And he had contributed so much to the field of medicine. And his nosological method of classification is what still now it is being practiced, the approach of classification. And followed by Thomas Sydenham. The methodology of classification is also upgraded by one of the French physician and botanist known as Savages, and also Morgagni. We know about these people. I think you know about some anatomy foramen of Morgagni, if you remember, which is in diaphragm, which is named after him. He's an Italian anatomist. And he also has the basis of classification based on diagnosis, prognosis, and treatment. And a person known as Theophrastus, which we know as Paracelsus, he also had the classification which is practically applied in his system-wise understanding of, or the temperament-based understanding of classification, which includes sanguine, phlegmatic, choleric, and melancholic temperament, which is actually seeing the psychiatric aspect of you. Okay, so these are some of our historical understanding about how people actually classify diseases. Now, the very pioneer of the classification, which we know personally, is about William Cullen. He was a very important physician. He is a contemporary of Hahnemann. And before William Cullen, and so many like Vogel, McBride, Sarkar, and Philip Finlay, all have contributed their contributions to in classification of diseases. And all these have actually taken a new dimension once the international classification of diseases has come. And it has originally started in 1893, and which adopted is actually Bertillon classification. If you remember this name, Bertillon, in forensic medicine, we know Bertillonian classification in anthropometry, this in identification of the person. Bertillon has contributed so many other things, and one of the important contribution is actually his international list of causes of death. This causes of death is actually later on turned to classification of disease. And this intention is all important. Why I say this? Because Hahnemann classification, you see, he is not listing the causes of death. He is listing the causes of the origin of diseases. He is more towards the origin of diseases. Now, you see the intention, you see the thinking behind a classification. So these all things actually you have to have in your mind to understand or to study Organon. So that's how. Okay. And once the World Health Organization has taken the charge of classifying diseases, altogether now it is being changed now. Now we actually have ICD-11. Now what you see in the slide is actually ICD-10. I try to give you the overall nutshell of the entire classification, right from 1 to 12. Whereas you see, we predominantly, these are actually practically we don't use, but we predominantly use this in psychiatry. That's what in fifth section, F00, it starts from F00. And you see, we predominantly use it in psychiatry. Mostly people use also American Psychiatric Classification, DSM 4 or 5. Now, ICD-11 is also being used. Okay. So when you keep these things in mind and then you enter Organon, I think you will have a different dimension of understanding, either in learning as well as in practice. So about classification, what actually Hahnemann say? You see, Hahnemann, I feel as Hahnemann as an individualist and naturalist. And see what Hahnemann has to say. This about this classification, what he said, you can read this aphorism 54 and 47 and see how I am connecting with classification of disease. Every one of these following each other from time to time differ greatly each from other, and they call themselves as rational medicine. Okay, so you see there are so much differences, and every builder of such system cherished the haughty estimation of himself. This was during Hahnemann's time. Okay, he was able to penetrate into the inner nature of life of the healthy as well as of the sick, according to empty assumptions and arbitrary suppositions without honestly questioning nature. So Hahnemann is actually entering into the process of nature. Every time he actually come out with the proposition, come out with a concept or an idea, he actually had his own observations, honest observation. Okay, and most system gave therefore names to their imagined disease picture and classified them every system differently. So everything was based on system based to anatomical or pathological process. But Hahnemann is trying to give you the process of nature itself. So understand the word process, because the term process Hahnemann uses it invariably at many places. Okay, also in chronic disease. So when we understand what is the process, I think then it gives us a whole idea. So nothing could teach the physician in a plainer. It should be simple. Okay, it's not too complicated, in a plainer and more convincing manner than the process that takes place in the nature. Okay. So this is the core, I feel. Okay, this is the core of understanding of classification of disease. And basis of Hahnemann's classification disease. Because why? Because he classified, actually he was an allopathic doctor. So he differs from the allopathic mind. This is the most difficult part. Whatever you have learned in your life, to unlearn and then to relearn is different. It's very difficult. This is the most difficult because now we approach homeopathy mostly through modern pioneers' understanding. When we go to the core back of what Hahnemann, it will be difficult because we have already learned something. And we have already learned based on pathology, practice of medicine, anatomy, and physiology, and we have some idea. And with this idea, we enter Organon. And it is very sad thing like Organon is being taught very limited in the first year and second year, which was actually a very wrong methodology what actually CCH is adopting, or now it is NCH. I feel like the Organon and the main major polyplus actually has to be taught detail in the first year itself because that gives you the connection actually with the homeopathic subjects. Now it is being lost. Okay, let's not go to that politics. Now what I'm trying to say is like Hahnemann was an allopathic physician, and then he comes to be a homeopathy later, and he actually have to discard erroneous perceptions what has happened in what was actually followed in allopathy. So during Hahnemann's time, it was grossly classified as general and local. Whatever that you see outside the body, it is local disease. And general disease is a very imaginary process, like we know in the introduction of hormone, if possible. We will discuss about introduction of hormone in detail later. Okay, it is actually removing the cause or material cause. So this all comes under in general aspect. And the keen, intuitive, and logical and scientific mind of Hahnemann, he understood the perception, whatever he have done, the study of disease based on this nosology, based on this diagnosis, based on this system is wrong. And all the classifications ends in varieties, but in medicine we have to deal with the individuals. Okay, now we have split the people. Now today in my practice, patients comes to us because recently I had a case of a headache. The person has gone to 5 different doctors. First she gone to a general physician. Then they thought it could have been due to an ENT problem, so they went to ENT doctor, and then to a neurosurgeon. And finally, she herself discovered a teeth caries in her. She discovered a teeth caries, and she went to a dental doctor. And dental doctor, this is the problem. Let us remove the teeth. This is the cause of headache. And finally, she comes to a homeopathy. It is very difficult for me to convince her. This is your the disease is as a whole you are suffering. It's not particular one part is suffering. So this is what actually Hahnemann have in mind to keep the individual in front than the body or than the part. Okay. So the basis of Hahnemann classification include the symptomatology, the etiology, and the past history of suppressions, the pathological process which is going on to understand the prognosis, whether it is curable, not curable, and the practical treatment approach, whether you have to treat or not. If you are in discussion, you don't have to treat. If it is a palliative case, like in a foreign system, you have to go for a palliative approach. You can take a palliative approach. Or it is difficult to cure, you have a separate approach. It is easy to cure. Okay, so practical treatment approach, this is very important. This is how Hahnemann actually classified the disease. Okay, it's not based on just system alone. So this is entirely different or even opposite to the current notions of classification of disease. So we have this, now most of us are going to follow maybe ICD-11 or even DSM-5 or 4. So how we can incorporate Hahnemann's ideology? This depends upon your own personal knowledge about Organon. Okay, and his approach is to disease is essentially clinical, not anatomical or pathological or laboratory. Now mostly many diseases are based on laboratory. Like if you have a fever, how you will diagnose, how you will classify? You have to do a blood test and you find it whether it is due to viral infection or a bacterial infection or a parasitic infection. Okay. So this is how the diagnosis, also the treatment is also going to start. But Hahnemann's idea is totally different. And his views regarding naming and classification underwent considerable modification from first to sixth edition of Organon. This is very, very important. Like within the period of 35 years after proposition of Organon, right from 1810 to 1842, you see Hahnemann has modified it very extensively. And now we have almost crossed 250 years after that, and how many additions we could have gone, how many additions and modifications we could have done. And because of a religious set of ideology, We stick to certain things. Hahnemann himself has modified, and we are failing to modify Hahnemann's certain aspects. Okay, it's not like we are not so genius like Hahnemann to modify whatever he said, but I think there are certain practical things we can see because the diseases has taken a big turnover. Like most of the diseases what we see in Hahnemann's time is actually has gone a different modification. Now what Hahnemann seen in his period, the syphilis, that gonorrhea is actually has changed a lot. Suppressions is one reason, but also there is an evolution in the bacteria as well as virus system. We have seen new diseases. HIV was not there. The tuberculosis what Hahnemann mentioned is not the same tuberculosis anymore. Now the most important tuberculosis is drug-resistant tuberculosis, which is altogether a different version what Hahnemann saw in his tuberculosis time. In his time, okay, and then now we have seen the COVID era, which is entirely new, which is actually changing the entire medical scenario, even personal scenario. Okay, so diseases has changing, the world is changing, life is changing. Okay, so according to that, we need some modification definitely. So this is actually we all aware about this wonderful schema what actually Dr. B.K. Sarkar presented during our college times, during our undergraduate as well as postgraduate level. This is what we studied. And during my PG time, when I was like a little bit crazy during my time, like when we study Organon, I had a lot of questions regarding it. Okay, and I felt something is actually having some error. It is with due respect to Dr. Sarkar because he's a very great man. I studied Organon mostly through his book only. Okay, but I felt some modifications invariable because it has to, when we see the book, it has to be condensed in that particular way so that we can go very easily. For the easy methodology, actually, Dr. Sarkar might have adopted this schema, but I feel some modification is definitely required in this particular scheme. Okay, so I tried to add up or to give my contribution, so that's how this classification of disease presentation actually came up during my MD period. Okay, so what are the classification? When you see carefully, when you see the subtypes of indisposition, there is indisposition also has a subtype. It has acute indisposition and the chronic indisposition. Okay, and you see that is not actually mentioned here. And you see there is also acute epidemic and intermittent diseases have subtypes. Mental diseases have subtypes. I feel these actually have to be incorporated because they have certain plan and a practical treatment approach. I feel if those are also included, the beauty of the classification would be added up more. And Hahnemann had classified one-sided diseases as miasmatic. He called them as SORA or sometimes combined with syphilis. So when we see here, these one-sided diseases are not coming under miasmatic. Okay, it is classified separately. So I felt this also has to be modified. And why intermittent diseases were not included? It's a very big topic. Intermittent diseases, a little complicated and difficult to understand topic also. But this is a current scenario when recurrent respiratory infections are coming, when there is epidemics are surging. This intermittent diseases topic is very important. And his term as occupational disease, because Sarkar has mentioned as occupational disease, nothing wrong in giving a new name definitely, but as such, whether it is only occupational disease, okay, that is important. That particular thing is not actually available in Organon. And miasms were mentioned in both acute and chronic conditions. Okay, because here you see miasmatic is exclusively to chronic what Sarkar has given, whereas Hahnemann has clearly tell us about acute miasms and the chronic miasms. And there are about compound miasms. This is the most debatable and complicated thing, like psychosyphilitic or psychosyphilitic. These things actually, I think it's already been practiced during Dr. B.K. Sarkar time. That is around 1940s and 50s. And even before that, this combination of miasms has come. Whether this combination of miasm was existed in Hahnemann, this concept is actually was told by Hahnemann. It's a very big debatable topic, and let's not go out of this topic. If chance comes, I think we have to discuss about this also in future. Okay, so why I told all this is with keeping in mind when you go into little deeper of what I am going to say before entry into a schema or before entering to a classification, we should know some of the basics of things what we are going to discuss. So first is about disease. What is the definition of disease? And you see in aphorism 11, this is there are other aphorisms also describe about disease, like in aphorism 15, aphorism 17, and also in aphorism 6 and 7. There are description about disease. Okay, but for me, this is the perfect description of disease. When a person falls ill, it is only the vital force bearing to such an abnormal state that can furnish the organisms with its disagreeable sensations and incline into the irregular process. I told already about the process. Okay, to the irregular process which we call disease. Okay, so there are too many type of diseases Hahnemann is describing about. He is talking about dissimilar disease and similar disease. This is entirely different thing. Okay, this is about the what we say like the type of diseases, or we can say in phylogenetically the nature of diseases. Okay, dissimilar and dissimilar. But this is not going to come in our schema. Okay. And about in this question, there is something called disease which need a medicine. This is what Hahnemann strictly said. In this question, we need not to give a medicine. When you remove the cause, when you remove the maintaining cause, the indisposition will heal. Okay, the Hahnemann mentions about indisposition in aphorism 150. The term is about 150, but also in 7, and also in aphorism 77, which is called as inappropriately named chronic disease. Some people call it also pseudo-chronic disease. If some of the example you see, he will remove the strong smelling flower if the patient is having a syncope or a hysterical suffering. Just remove the strong smelling flower, the patient is okay. And you have a foreign body in the eye, you remove it, the patient may be okay. And also you have a vesicle calculus, it is in surgical conditions. Okay, a crusher vesicle calculus, open and imperforate anus, this has to be removed. He is also having a cross reference in aphorism 186. This is told in aphorism 7 as well. And more importantly, we need a cross reference also in aphorism 224, where I prefer to call it as a mental indisposition, like which needs a counseling. When you are sad, when you feel mentally ill, some good explanation, some good consoling words may heal. You may need, even don't need a medicine. That's how the field of psychology and the counselor works now. Okay, this is because now we see the era of COVID is going to be a mental disease era, and depression and anxiety will top the chart even above fever and headaches. Okay, so in that we need good friends, we need good counselors. Okay, we definitely need good homeopaths. Okay. So the counseling in mental disease is also a part of indisposition or a moral remedy as discussed in person 16 and 17. Okay. So other definitions include basically Hahnemann classified diseases. When we see dynamic diseases, he classifies into acute disease and chronic disease. And acute, both are seen in person 72 itself. So acute disease will have a rapid morbid process which has a tendency to finish their course, and chronic disease which has a imperceptible beginnings and they cannot get cured by itself. Okay, acute disease even cure without a medicine, but if you don't give a medicine, it do the crisis and lysis phenomena in your body, and actually your body have to sacrifice some part of it. Something can happen. Whereas in chronic disease, they don't extinguish by themselves. They need a medicine, and they are caused by infection. The word is important. Infection by a chronic miasm. So it's all together will complicate you, but let's not go detail about miasms and about the infection thing now. And regarding aphorism 73, this aphorism 73 has a beautiful conception. Okay, I think we can do a short presentation about acute disease as well in future. Okay, so basic classification is about individually, sporadically, and epidemic. Individual diseases, sporadic diseases, and epidemic diseases. So individual diseases, what it attacks one person at a time. Okay, it's not like many people. It attacks individually, one person at a time, and it can be caused due to either in excessive food. The triggers it can be excessive food, a severe physical impression, chill, overheating, strains, physical irritations, mental emotion. These are the triggers. Actually, they are the exciting causes. And some of the examples I would like to keep is viral fevers, pneumonia, and acute abdomen, stroke, and gastroenteritis. Okay, and we cannot exactly fit the diagnosis in exactly to this particular classification. A viral fever, which have a tendency to spread to many people, it may come under either sporadic or epidemic. But if it is attacking only individually, it is individual. For example, a chicken pox. If it is only to one person, it is individual disease. But if it is coming in a group, then it may be called as a sporadic illness. Likewise, the gastroenteritis or food poisoning, if it is only for one person, it is gastroenteritis individual. Whereas if it is happening to few of the people all over that particular area, it may be either a sporadic or epidemic. Okay, so that's how. So you see, this is not exactly nosological. It's more towards a practical process. Okay. And the other definition is about sporadic. I would like to give some examples like madrasa. This term is madrasa because just to understand about the locality. Hahnemann clearly talks about environmental influences there. So the term actually comes from actually that particular area, but it is nothing but a viral conjunctivity. It is now seen everywhere. And also, when you see there is a changes in environment like lightning, thunderstorms, such things actually can cause shocks to some people. And depending upon the environment, some periodic illness comes. Like previously during summer, and this pox diseases usually come like the chicken pox and smallpox. Now smallpox is not there. But now you see, already I told you, the virus thing and the diseases have gone to enormous modification. Now we see in Wayanad, we see in rainy season we are seeing chicken pox. Okay, so there is a great amount of differences. And when we see sporadically, especially some of the marshy area, some of the mountain area, according to the seasonal changes, diseases also can come. So these are sporadic. And when we see epidemic, during COVID time, we know the importance of our genus epidemicus, which is actually a misnomer. And one never uses the term genus epidemicus. Okay, so that is a different story. But he classified diseases as third acute classification is epidemic diseases, which are having a contagious nature or an infection nature, which is actually spread across community, which are, affect many people at a time. And I highlighted the aphorism footnote. You have to read because it's a very important footnote. Lot of new learnings we see every time when we read. That's why I told you. And he classified the acute diseases into two, means epidemic diseases into two, which is having a fixed type, which is having a recurring type. Okay, fixed type. The examples include smallpox, measles. Once it comes, it produces a lifelong immunity. Okay, there are certain diseases which have the tendency to come again and again, like yellow fever and cholera, which does not produce a lifelong immunity. So in epidemic diseases, we can have these modern diseases like dengue, chikungunya, cholera, all this. Okay. And why I said about diseases of Iraq is because it is actually due to calamities of war. Certain epidemic diseases will happen, and also famine. In Somalia, also certain diseases may be due to that. Okay, that's why. And I have not modified many of these slides, which I actually did in my PG, and it was happened 15 years before. So some mistakes may be there, and I would like to tell the audience if you feel like some corrections is required, definitely please be free. There is no this one. I am happy to listen, and I will be open as well, even to correct. Okay. And regarding with the acute miasms, Hahnemann also talk about half spiritual miasm and half acute miasm. These terms are actually mentioned in chronic diseases. And half acute miasm, as most of you would have studied for your entrance exams, which is related with the heterophobia. And half spiritual miasm is related with measles and the other diseases. Okay. And regarding chronic disease, Hahnemann mentions about, for some he mentions about artificial chronic disease, which is usually due to an allopathic mismanagement or excessive management. Okay. And this aphorism has been highlighted in the School of Predictive Homeopathy, one of my guru, Dr.Jerald Jeyakumar as well, which actually strongly I disagreed with him is this particular aphorism. This is exactly regarding artificial chronic disease and why sir has to highlight this particular aphorism as miasm. Okay, because this is non-miasmatic non-miasmatic cause of disease as per Hahnemann. Dr. Jacob sir has taken this aphorism to describe his pathological concept of mice. Okay, and the colors are actually for solar psychosis and syphilis. So that is actually from Ortega. Ortega gives this color. Okay, syphilis have this red color and the psychosis have this yellow color, and green, yellow, red. These are all for signals to remember. Dr. Jeyakumar also adapt. Green means functional, so it is easy to treat. Psychosis means you have to be careful. And red means syphilis, that is very dangerous. Okay, like that. Okay, but this all actually, this is a different aspect of perception. I don't actually contradict empathy. When you go through that kind of understanding, it helps you. Definitely, it helps you, and you can stick to that particular philosophy. All we believe, either you believe God or you don't believe God, we believe based on our ideology only. Our ideology only takes us to the next level of life. Okay. So if it is helping, definitely yes, we can take it. Okay. Some of the examples what we can see in present era is post chemotherapy. Post chemotherapy patients usually suffer with artificial chronic disease only, and definitely we have to help them. And anti-epileptics, mostly the epileptic seizure disorder might have disappeared. Whereas patient, if they withdraw medicines, either the thyroxine medicine or the epileptic medicine or psychiatric medicine, it's very difficult for them to withdraw. So they have to continue. Even for gastric complaints, people cannot live without the gastric tablets. Okay. These are very simple disease, but once they started taking it, they cannot. So, so this is what we see in particular practical aspect of life as artificial chronic disease. We can add up so many things. This is a big topic because artificial chronic disease is a highly bigger topic because right now due to drug mafia and all these things, it is actually a big web. Okay. So if we get a chance to discuss about introduction of Organon, I can correlate that what is actually this artificial chronic disease and what is the spider web beyond that. Okay. And in connection with person 74, he is also describing this one of the most difficult disease to cure, most destructive disease to cure, this artificial chronic disease. And if there is a chronic myasthenia lurking behind, definitely they are supposed to give a medicine. And some other name he gives in person 77 followed it is actually diseases of inappropriately named chronic disease. Okay, I think that may not go deeper. And like most of the anemic diseases, anemia, which is due to deficiency, protein energy, malnutrition, and other deficiencies, and also those who have this substance abuse also may not be strictly to inappropriately named chronic because of certain habit only they have certain problems. When we remove the problem, many people will be okay. And also people in famine, those who in drought, they don't need medicine. Okay, they need food. They need proper support. So all these things. The other Hahnemann has clearly mentioned. You see, those who reside in unhealthy localities, those who live in slum, they will be having constant disease. They need to be given the proper hygiene and life support rather than medicine. Like sometimes due to our over ambitious, over homeopathic mind, we think only in aspect of medicine, but there are so many other things. And most importantly, Hahnemann mentioned about you see who ruin their health by over exertion of body and mind. Those who do exercise extraordinarily, those who do keto diet, they ruin their health by over exertion. And those who deprived of exercise are under of open air. Those who live in AC conditions like software engineers and techies, they are deprived of proper air and sunlight. Okay, these all actually you are supposed to provide. And those who live in constant state of worry, you have a wife who is a drunkard, who is having a psychiatric illness, and you see a spouse living with a psychiatric illness complaint, they will be in a constant worry. And this is actually an inappropriately named one. You need a counseling and all that. Okay. So what is a true natural chronic disease? This variety have the enormous amount of classification what is we are going to follow. So this is actually the definition is there. And whenever we read about true natural chronic disease, we should also have the connection with the chronic disease book as well. And most importantly, I have highlighted certain things. Now, for some 1881, he is giving some of the examples of under Sora, which include melancholia, rachitis, cancer, right from psychiatric to TB to cancer to paralysis to even functional disease like hysteria, amenorrhea, and impotence. All that, everything comes under Sora. Okay. So these all will be hopefully debated in your Organon classes. Okay. And one sub-classification in this chronic disease or true natural chronic disease is one-sided diseases, which is having only very few symptoms to prescribe. One or two principal symptoms only. And they may be either an internal complaint and an external complaint. Okay. So like that we can classify. And most importantly, how he call it, why he is actually calling it as one-sided, because they are less amenable to cure. They are not presenting the entire picture. They are showing only the one face of it. So it is difficult to cure. So the presentation, the symptomatology, as well as your practical treatment approach, everything differs. So in one side, you have to give a partially similar medicine. After that, you see accessory symptoms are coming in. And after that, you take a collective totality, and then you have to prescribe. Like the series of medicines you may have to do. So you see the management itself. This actually more practical. So even now we see most of the diseases comes under the one-sided diseases. Though there is a wide variety of presentation, like mostly people will come with us a report. They may not have any presentation like diabetes. They come to us with the elevated sugar level. Some people come with us an HBV positive, come with an HIV positive. There are no symptoms available. How much ever they grow. Okay, these things will come. So these are actually increasing nowadays, and also only the pathological presentations will be there, like BP is elevated, no symptoms, even not even a headache. In cancers, they present only the general symptoms, very common symptoms of the disease. Organ failures that we have, it is mostly towards the palliation. We have only common symptoms of the disease. These things can happen. So these examples I have given. And in that one-sided disease, one particular presentation, one particular classification is local maladies, and those changes that appears in the external parts of the body. And there are subtypes of it. Okay, those that is one thing is those maladies caused solely by an external lesion due to an external cause, which is actually related to the surgery. So Hahnemann does not exclude surgery. You may need a mechanical aid, you may need a surgical aid. Okay, but also require a dynamic aid. The dynamic aid, like in case of a road traffic accident, you may have to support the tissue. In case of burns, you may have to resuscitate the patient with the fluids. Okay, when the patient is born with a cleft palate. Okay, so these all things actually need a surgery. Okay, if the patient is having imperforate anus, that is already told. The patient is coming to you with a peptic perforation. Okay, these are the examples. Some examples may have some confusion because not due to external lesion. So that's why I put a query mark. Since these are coming under the surgery, because this needs to be actually definitely you may have to go for a surgery. So the treatment part definitely need a surgery. That's why I put, because in a peptic perforation, though peptic ulcer is a dynamic disease, once it is been perforated, you may have to switch it. Otherwise, the gastric juice will spill over and it produces even a very fatal condition. Okay, you may have to intervene immediately. That's why a surgical this one may be required. And in case of a tumor obstructing areas, sometimes the tumor may have to be operated, which may be endangering the leg. So though it is not an external lesion, but it comes under the purview of surgery. So that's where I cannot put anywhere there. So that's why I put there. And commonly it has been misinterpreted during Hahnemann's time. Most of the skin complaints like warts and syphilis, chancre, and all things they considered as a local disease only. But Hahnemann clearly see it as an internal disease. So that's how the Mason origin has come, psoriasis, psychosis, and syphilis. In modern days, we can relate it with the most common skin complaint, atopic eczema, and psoriasis, and whatever polyps we see, ganglion we see, and TAO. TAO is mostly considered as a local disease, right? Whenever they see, they amputate the organ. Okay, and even alopecia is considered. They try to even now produce a steroid injection to that particular skin. They don't consider what is this alopecia actually, which is usually an autoimmune disease. Okay, and SLE. It's an autoimmune disease, neurofibroma. The single neuroma or neurofibroma trying to operate and it produces complications. Okay. And acute diseases of recent origin. This is a separate classification in the surgical illness. You see, for recent origin, surgical illness we may consider as an acute. The remedy itself is changing there because Hahnemann tried to give antipsychotic in many cases, but if it is of an acute origin, we try to give aconites, Rustox, mercury. We can see this occurs some examples. In that, I would like to add also appendicitis, quinsy, and all. Okay, which we may need some acute local medicine because without surgery they can get cured. We have seen cellulitis, gangrene. Without may not need a surgery. We also quinsy, which is most of the time was suggested a surgery. We could practically heal without a surgery. Okay, with medicines we can. That's why I have not put in the first type. And a very important classification, very beautiful classification is about mental disease. It needs a big discussion. As Hahnemann say that my mind is always altered, and he describes mind as an invisible subtle organ. This invisible subtle, the usage of words are so beautiful. Hahnemann has this rich, what we say, vocabulary, beauty in his description. So when we read it again and again, we see something, some spark is coming. And during in the definition, he says mental diseases are of soric origin. They have this one-sidedness because this mind is not exposed, properly exposed, and they are more difficult to cure. And recently, I studied about the Clockenberry article for a reference. And everyone should read that as well. When you study about mental diseases, you have the connection because he has written it before discovering homeopathy. Okay, so that lot of original idea about mental disease. He is a pioneer. He was an asylum keeper, so he know more about mental diseases. Like the modern day users, modern day people, how American classification, everything becoming more and more complicated. But Hahnemann has made it very simple in a practical approach of it. And most of us will know about the type. You can see how many types are there, and in most of the notes, most of the guides also will give you these 4 types. I also have considered as a 4 type, but I can have a different dimension about this mental disease and about the perception. Hopefully, in coming sessions, if possible. Okay, the first type is what we study is about the corporal disease. The physical complaint transformed to a mental illness, or we can say in other words, an organic or organic mental disease. Okay, and some of the examples we can correlate the modern terminologies. We can correlate is Alzheimer's, schizophrenia, bipolar mode disorder, and which is due to a severe, mostly due to a stroke. Patients may go into emotional disturbances, mostly mood disorders. They go and also nowadays people in cancers. Okay, after post chemotherapy, many people go for hyponatremia, hypokalemia. They develop anxiety, and hyponatremia expresses severe agitation. Okay, they do bizarre things. And previously, mild people they go crazy, and so many things happen. Okay, this all actually mental disease transformed here. Physical illness transformed to mental illness. If at all you see palliative sections, you see these things actually very common. And in that mental illness, in an organic mental illness, it may produce as an acute presentation, which is very dangerous, which is very, this practicality is like, this may need an asylum, or this may need an isolation, a quarantine, because they are little dangerous. So in that, Hahnemann has given examples of mania, and he has given some of the medicines like stramonium and verona, all that. And here we can correlate this about the delirium tremens due to even alcoholism and other deliriums, like already I told about some of the uh, uh, electrolyte disturbances I have told already, and impulses and perversions. Some people are sexual maniacs are there. Some people are psychopaths are there. When they develop this acute attack, they are little dangerous to the disease. So when this acute comes, we may need not to go for an antipsychotic medicine. We may have to give an acute medicine. And doubtful mental disease. This is a very common scenario. This is what going to predominate the COVID era, like anxieties and depression and confusion. And also one particular another thing is going to come is actually idiot syndrome, which is internet derived information obstructing treatment. We know that. Okay, idiot syndrome. People Google it too much and they go for an anxiety and they imagine so many diseases. Like we have the second syndrome in our college time. Like people started reading new disease, and we imagine we are getting this disease. Okay, many people faint. They see a skin complaint, we think it's leprosy or syphilis, something like that. Okay, but this has been now becoming universal. Google is giving you all references, and this idiot syndrome is in heavy rise. And so this all comes under doubtful when you they need actually counseling. They need a proper confrontation. Proper, okay. I have seen cases gone worse after counseling. Simple disease has gone bigger. I have seen personally because of the error in counseling, because of your understanding in counseling. And fourth disease, psychosomatic is what we usually think. I mean, prolonged mental disease, prolonged mental causations, emotional causation, causing to a deeper psychiatric problem. Okay. So some of the examples which include the psychosomatic illnesses, somatoform illnesses. After grief, they go for a depression, which is not towards the organic form. Okay. And then they go for an organic form, suicidal tendencies. It may switch over to the type 1. Okay, because they don't, because when we see type 1, usually you have to get the information from attenders as well. Because I recently had a case of schizophrenia. There is no connection between the description, what the mother say and the patient say. And finally, I found both mother and the patient, both are having some psychiatric illness, and we derived it from the schools and the people near neighbors and as well. Okay, so such things can happen. Whereas mostly psychosomatic illness, the patient himself will or herself will give you the description. Okay, will give you the details. So these are the things actually about mental disease. I think mental disease is a very big topic, and you can see the what we say the intelligence and perceptions of Hahnemann, the greatness of Hahnemann, when we actually deal with psychiatric illness. I'm right now dealing with children's child psychiatry. I'm a district convener of Sarkar project, which is I'm dealing with mentally ill children, which include autism, ADHD, and all that. So when we go to the classification, we can imagine how we can understand how actually Hahnemann have interpreted these things very long ago, before 200 years before of this all these available classifications. Okay. The most complicated and the final section is about intermittent diseases. Every time we read, we felt we have not read anything. Okay, such a complex way of description. Because why is because I will tell you the reason. Because Hahnemann had watched these fevers very closely. We actually enter fever based on diagnosis. Okay. Now we enter based on our practice of medicine knowledge. And Hahnemann entered it differently. He see the disease from the prodrome. Whenever a patient is having a fever, what happened yesterday, day before yesterday, how she slept, what was the dream, and how it started, the fever, how it started, either the heat state, cold state, sweat state, how was it, and such minute descriptions happen when we see the articles related to homeoprophylaxis in scarlet fever and Escherichia cholera. This is wide description, and this is what exactly the methodology he adopted in description of meteoritic fever as well. And you see, every drug is being so detailedly described about the change. Okay, right from first day to second day to third day. So close observation Hahnemann made, and that's how he could able to relate it. That's how he could able to understand it, and how there he is having this observation of alternating diseases. So how, because there are remedies which have alternating actions, like for bryonia, you may have to go for a repetition. He is not advising single dose there. And also you may have to alternate with other medicines as well. These all things actually very peculiar and very characteristic of Hahnemann understanding. Even now, certain doctors exactly follow Hahnemann methodology. For them, it is easy, but when we go through practice of medicine knowledge, it will be difficult. Okay, so these are the subtypes. Intermittent diseases are of two types, either febrile or non-febrile in nature. Non-febrile is what these episodic diseases like asthma, epilepsy, irritable bowel disease, rheumatoid arthritis, they have articulate. These all things have an episodic presentation. The alternating disease like we see, which is also now called as asthma eczema syndrome. Dyspnea and eczema actually alternate. This is a known, very common alternating disease. And but Hahnemann specifically mentioned about alternating disease mostly in fever. So many fevers actually alternate. The type actually alternate. The presentation alternate. Okay. And he speaks about typical intermittent disease. Something is typical, something is atypical. Okay. So some of the examples I would say, as we know, intermittent fevers are of four types, and intermittent fevers which have an epidemic type, which have an endemic type, which are typed individually, and endemic in martial districts. And everything has, I tried to correlate with the modern diagnosis like dengue, chikungunya, and all that thing comes in type 1. And the epidemics of intermittent fever, which are none are epidemic and none are endemic. There is no endemicity in this one. And there we can call like COVID-19, these are epidemic. And it is not exactly, okay, this is about the presentation. The type 1 is actually having variety of presentation, like variety of paroxysm. Whereas second type is more of a single paroxysm. Second type is actually having a fixed or same type of presentation, so that the approach is here genus epidemicus. The approach is epidemiology. Okay. First is actually towards the non-antiseptic medicine, whereas second type is more towards the genus epidemicus. Third is also it's an individual type of disease, hence you may have to go a non-antiseptic medicine. And if psora is coming in, we may have to give antisora. And fourth type is what Hahnemann advised about because it has a periodicity and recurrence to remove the endemicity, you may have to give China, specifically sulfate of China, which is Chinyan sulfate. You can read this aphorism on the footnote. Okay. And you see now, this is actually practically followed now also. Because in COVID, when we see that when there is no option was there, first prescribed medicine was HCQ. Okay, when there is such kind of thing is then the whole world actually follow phenol derivatives only. Hahnemann described about China malady in these sections. Okay, and we also should not do the same mistakes of randomly giving China. Okay, and in epidemic type 2, Hahnemann also advises if the genus epidemic is actually if not completing the action, you may need a dose of heparin. And okay, this is the overall description in a short form, as much as I possibly describe. I have given you. With this knowledge, so many things actually is there because Dr. Sarkar's description gives you only very limited understanding. Whereas now, when we understand Organon in detail, I think we need everything to be put in a schema so that which is practically we can use it. Okay, so let me describe my schema here. And it is not strictly what we say logical. I may have some errors, and I would like to receive the corrections as well. Okay, I try to make it complete as much as within my knowledge of and my limitations. Okay, so Hahnemann broadly classify the diseases into either indisposition or play diseases. Okay, so in indispositions we require medicine. Sorry, we do not require medicine, which means maintaining causes renewal, whereas diseases we definitely require medical aid. And indispositions are also of two types, either acute or chronic. Okay, acute indispositions and chronic indispositions. The descriptions are there of person 7 and also of person 77. Or it can be either physical or mental. If physical indisposition, there are too much of explanations are there in the footnote. And also you can see about mental indisposition. We can see in a person 224 and also in moral remedy in a person 16 and 17. Okay. So this is about indisposition in general. And now most of the indispositions are treated with medicine, and we claim with medicine. Okay. Okay. This all practically when we do, we know that. Okay. And when we talk about diseases, Hahnemann actually describe into this aspect. Either you need a surgery or don't need a surgery. Okay, you need a dynamic medicine or you need a surgery also. This is a very broad classification. And also it may be disease may be single or complex. Either it may be present as a single disease or complex disease. This is described under similar disease and dissimilar disease section as well. Even under miasms. Miasms may be presented either as a SORA also or complicated with the syphilis. That also. This is different dimension. Okay. This is about the etiology. This is about the practical approach. And in the non-dynamic, okay, aspect, it may be either an acute disease or chronic disease. Also, surgical illness also comes under acute and chronic. Due to the very less space I had, I could not describe it here. But even surgical illnesses also have an acute and chronic variety. Like how with dispositions we see acute and chronic and physical and mental dimension. Like that, in surgical illness, few surgical, surgical medical, as well as acute and chronic is another classification. Okay. And, acute diseases are described under upper sum 73, whereas chronic is described under upper sum 74 to 81. Okay. And in acute diseases, the chronic diseases we see in upper sum 74 to 81 when he described, he clearly mentioned about it. This is about purely Hahnemann classification. Okay. He clearly described about two chronic diseases, that is artificial chronic disease and inappropriately named chronic disease. They don't strictly come under miasms. Okay, so their management is little different. So that's why it is coming into the classification miasmatic and non-miasmatic. There is no such descriptions coming under acute diseases, because usually acute diseases either a latent explosions of latent SORA. This is what we usually know, or even without SORA it can happen. Okay, in that it may either attack a person individual or to a single person, or it may attack a few or many persons. In that it is being classified as either as a individual illness, individual acute disease. In that individual, it is again further classified into either a febrile illness or non-febrile illness. In the febrile illness, the febrile pattern will be either intermittent type or non-intermittent type, like we see in intermittent fever section. Intermittent fever also have a chronic type, okay, like a chronic malaria and all these things can have a chronic type. Mostly it may be presenting with an acute intermittent type also. And febrile illness may not have a non-intermittent, continuous variety can happen. And in acute diseases, non-febrile is also common. Either it may present as a physical or mental. In the physical acute diseases, you see the upper 194, you see it is a erysipelas is an acute presentation. Okay, and it is not necessarily with have a fever. Many acute diseases are there. May not even gastralgia. All these things can have an acute presentation, and non-febrile under the non-febrile category. Acute diseases may also have a violent acute presentation at mental level also. That is we see upper 200. And acute diseases, other type of acute diseases after that, other than individual, either it may present as a sporadic, which is due to environmental reasons, or an epidemic, which is usually due to acute miasms, or which is having an infectious nature. In the epidemic nature, we see that it may be either occurring in two varieties, either non-recurring type or recurring type. And for non-recurring type, he calls it as a fixed. Also, he uses the word fixed miasms also. And for that, he has given examples of smallpox and measles and all that. And for the recurring type, he has given the examples of plague, yellow fever, and cholera. And for cross-reference, we have to also refer obstetrician miasm and acute miasm. This is all coming under infectious nature. Okay. So we have finished with the acute disease, and let's go to the chronic disease classification. Okay. The chronic disease classification is now divided into either non-miasmatic and miasmatic. So what is that actually? In non-miasmatic, you need an additional management, like you may need a maintaining causes removal and all that thing. Primarily not a homeopathic domain. So miasmatic diseases are primarily miasmatic domain, and also about the cure perspective also comes under miasmatic. And in the non-miasmatic, he has classified into two diseases, inappropriately named chronic diseases, which people also call as pseudo-chronic disease. Some call it as also occupational disease, which is only a limited understanding of it. Occupational diseases is one of the cause one of the category coming under inappropriate name chronic diseases. Nothing wrong in giving a new name definitely. So it is not exactly the same understanding of what actually Hahnemann meant. And artificial chronic diseases, some people call it as drug diseases, but I will not tell exactly drug diseases, but also allopathic mismanagement. Many things comes under mismanagement, not just the medicine as well. Also surgical and other treatment methodologies can actually chronically harm individual, chronically can make your vital force into a very chronic disease state. Okay, it's not just medicine. That's why drug diseases is a part of artificial chronic disease, and it is not exactly the same. And this is described of person, some is known and some respectively. So miasmatic in the sense these three terminologies, solar, psychosis, and syphilis is what Hahnemann is actually intending. And the presentation will be either with a fully manifested symptom, fully developed symptom, we get more amount of symptoms. But certain diseases will have only few symptoms are coming in, only few diseases are coming in. They are called as one-sided diseases. In the one-sided diseases, either it may have an external complaint, which is mentioned in aphorism 174, which is also called as, in old terminology, it is also called as local maladies or local diseases. Okay, it may be an external complaint or maybe an internal complaint. And that's what the what we say the treatment of surgery also sometimes may be coming up in the external complaint, where there due to external causes or external impressions will produce an illness that may require a pure surgery or it may need a medicine also. That is described under Organon 186. For definition sake, we can call it as a surgical illness. Okay, it may need a surgery. Also, with surgery, along with surgery, you may need a medicine. In cases of in causes due to internal causes, that may be presenting with either acute and chronic. Uh, in the acute causes are described, and acute pattern is described under 184. Okay. Diseases with the few symptoms, as we see in some of the guide, is described under either physical or mental. Okay. And the mental diseases having further classification either as a somatopsychic or acute presentation, third is of a doubtful origin, fourth is of a psychosomatic presentation. These are the types of mental diseases. Okay, they have all these things described here is having a one-sidedness. The another section is about diseases with the fully developed symptoms. They may present continuous or non-intermittent type, or they may present with an intermittent type. So we'll go to that aspect. Okay. So we have discussed about one-sided diseases. Now we'll discuss about the fully developed diseases. In that either it may be of an intermittent type or diseases with a continuous or non-intermittent type. The intermittent diseases typically at certain periodic interval if they come typical, they are called as typical intermittent diseases. And they may be presenting with either a febrile presentation or a non-febrile presentation. The febrile presentation, which is called as intermittent fever, typical intermittent fever, it is being classified under four things. That is sporadic and epidemic, which is having a multiple paroxysm or unchanging paroxysm, whereas epidemic that are non-endemic, which is having a single paroxysm, and pernicious individual intermittent fever, and endemic, which is in Marsh district. Okay. And other thing is actually not coming strictly into that particular scheme is half acute medicine about Hahnemann. And most of the rest of the all diseases comes under maybe this continuous pattern, like all the diabetes and what the thyroid illness and different problems. All diseases may be coming into that, and that is been described under chronic diseases under SODA. And I have not strictly classified. This is described based on my like SORA, psychosis, syphilis, what will come under SORA, what will come under psychosis and syphilis. There is another aspect of it. Okay, that is not following this schema. Okay, these are all practical approaches of chronic diseases, and I would like to add up like in half acute, as used the word half acute, we have described as acute and chronic. Whether this subacute pattern will come under or not. This was my idea. I actually wanted to rename half acute as subacute, but I think I was wrong during my PG time. Half acute Hahnemann mentioned is totally a different aspect about this one, hydrophobia. Okay, so that may not exactly fit into it. And I personally feel, because we have seen about this classification, the historical perspectives, periods are changing, times are changing, and Hahnemann himself has changed himself in about even myasm. Hahnemann first he called coffee is the cause of all diseases, okay, cause of all chronic diseases, and he changed that to myasm, okay. And he further changed to impotency, posology, repetition, so many things, and also the concept of vital force to vital principle. And so many changes Hahnemann had made during his lifetime itself. And the world is not the same as in 18th century no more. Okay, the world has drastically changed. There are so much of adulteration. Suppressions are happening in the very core level. Even the child is born before, even the child was not born, suppressions are happening. The child is being conceived and suppressions are happening. You see the environmental factors, it grossly has changed. The temperature levels, the ecology, everything is actually changing. So definitely there is a need of different understanding and perceptions about the diseases in this particular century with the homeopathic ideology, with the homeopathic historical and homeopathic philosophical ideology. And in my college days, I felt like homeopathy is strictly suffering because of some dogma. Like Hyman was against dogma, Hyman was against what we say the structural and what we say anarchy kind of thing. Okay, even Hyman doesn't want to be an anarch. What we say, like he should not be questioned. He himself he questioned, and he spoke with his juniors very frequently, and they have corrected him. This all happened during Hyman. Okay. So when we go strictly, when we attach our emotions or sentiments strictly to certain things, and I think we cannot grow. So I felt that need a definite upgradations in terms what actually is been there in Organon. And so I during my PG time, okay, I have not modified this slide, but I am wrong in certain areas. That's why I told like artificial chronic diseases. I felt whether we can keep drug diseases, but when I came into my medical homeopathic practice, I understood this artificial chronic disease is a bigger thing rather than drug itself. Okay. And like idiosyncrasy can be called as hypersensitivity, is a very common term we can call it. And exciting and maintaining causes are mostly nowadays related with when we study SPM, multi-causative approach. We see there are endogenous factors and exogenous factors terminology. And we call it as fundamental causes, something very related to myself. We can call it as an endogenous factor. But strict in sense, Hahnemann also called mycins as infection. Okay, there comes the dilemma, comes the contradiction and debate. Okay, I think when we speak up, when we discuss more, I think some clarity will get. Everyone will have new perspective. Will be happy to receive those perspectives. And mental diseases, the term is actually having this stigma. We cannot call it exactly mental diseases now. And that's why the term psychological illness is coming up. And local diseases, the term is actually outdated. So we can come up with new term. And even myasm can be changed. The term sora can be changed, psychosis and syphilis. Definitely syphilis, we cannot take this word to a public. Okay, such a stigmatic thing is there. Whenever we call about psychosis, PS, YCHO, psychosis, the psychiatric aspect of psychosis, what people suddenly correlate. So that our appeal, our description to the modern fraternity is understated. We cannot discuss with common public as well, also to a medical professional. So these things. Whether vital force needs to change. Okay. I'm not a genius to tell all these things. But I think this all actually come to an exposition. This all have to be come under an exposition. And the terms like accessory medicine, I think this all actually will be confusing. Half spiritual, half acute. This all will be confusing. and the term like prima causa morbi, these all are actually very outdated term. But this fixed maxim, why I made an striking is because we have to understand about this acute maxim which has a fixed in nature. Then only we can derive the concept of homeoprophylaxis. What is this fixity in it? Okay, it needs an ecological perspective also to derive a homeopathic prophylaxis. That's why I actually stressed it in that way. Okay, this was my college days perception. Definitely, it has changed, and whenever there is a chance for an open debate, I think definitely we can see things. And I feel like if you have any better terminologies in your mind, if you feel something can be correlated with the modern terminologies, I think that also is a very important thing. That's how we actually grow. So really happy to be here and really happy to share some of my understanding and learning. And I really thank Dr. Mohammed Sali for this great opportunity because I actually even I can say forgot or even not practically following Organon. There is no opportunity for me to discuss Organon. People feel Organon is a very dry topic, and so we don't discuss many a times. And he has given me this opportunity and actually gives me new dimension and makes me to work to sit and read Organon better. So I thank friend of mine, and I feel this platform should be made little to reach wider audience so that we come up in the name of homeopathy and spread friendship and love and more importantly humanity. And thank you all. Thank you so much.
Thank you for such a wonderful presentation. And now there is a lot of clarity, and directly or indirectly, you have taught us, or I'm reading in between the lines of your presentation, uh, to how to approach the organon. That's what I learned more. I learned a lot of things regarding the classification of diseases, but more thing I have learned is how to approach the organon in present times and how to understand the writings properly. So the classification of disease part, what you have done is exceptionally well, but there are some areas which I need some clarification. I feel my doubt will help my viewers also, and definitely if there are some other places where my viewers or our viewers are agreeing or disagreeing, they can put it in the comment section. So my doubt is like this. So from the beginning of the presentation, it was very clear that Hahnemann classified the diseases essentially in under the clinical aspective, clinical presentation. So when we come to the example of one-sided diseases or the intermittent diseases, there are some examples quoted, like for the type 2 one-sided local disease, like examples like eczema or psoriasis, polyps, all these were given. And for intermittent diseases, like examples like RA, all these were given, epilepsy. So my doubt is whether every case, when we give that disease name, the nosological term, when you said from the beginning, any time anatomical or laboratorial classification was not based on these things, or the nosological terms, it was not based on this. When we give examples like this, we have to give a clarity, right? Like regarding if the case is having only few symptoms, otherwise RA may not come in, or epilepsy may not come. If it is not fulfilling the characters of the intermittent disease, it won't come in the that part of classification, or the eczema or psoriasis will not come in local disease if it is not one-sided. That kind of clarity, or every case will not come, that clarity is needed, I feel. So what is your opinion regarding that?
Yeah, that is right. Okay, what I say is like certain type of atrophy present with the pityriasis kind of presentation. You see, some children present with the white patches in face. That is, and when we examine very closely, they have certain dandruff kind of presentation in their scalp as well. And when we probe a little more further, they have a history of atopy. The disease is not fully developed. Only the discoloration in the face is their complaint. They want to apply some ointments and all that thing. It's not the every atopic eczema. Okay, I actually given the example, and I would like to warn the audience as well. This is not exactly the term. Actually, does not exactly fit into the all the classification. This is for your easy understanding. I already told you, our understanding is based on practice of medicine, like more of an allopathic kind of understanding. It's not exactly Hahnemann. It's difficult to unlearn and relearn. Okay. In that, not every atopic exam will come under local diseases or onset diseases. If it is presenting only this particular symptom with no other constitutional disturbances, no other available symptoms, it may be called as one-sided and it is an external disease. Like how nowadays also allopathy thinks it is an external disease, right? It is not described understood as a general disease. Now also people think it's a local disease and try to apply an ointment. Even atopic eczema of that kind is applied on steroids and they go worsen and they develop interior problems. That's what I try to mention. So we cannot exactly fit into the modern day terminologies exactly into it. We can correlate for a better understanding and also our practical approach. That's what we cannot put it exactly there. Exact nosological definition, it means the exact diagnosis, we cannot exactly fit into there. Some portion of it for our better understanding, because many don't follow Organon as such, because the people who are going to see will be maybe non-Organon PGs also undergraduate level. For them to easy to connect what is actually it could have been. And also even a non-homeopath, even a medical person, if he sees, I think he can get the grasp of what actually Hahnemann intended. That's what I actually meant by this presentation.
Once again, I thank Dr. Jerald Jeyakumar from bottom of my heart for coming to Friend of Health and presenting a wonderful and valuable kind of compilation and contribution to the system. Whoever is passionate regarding Organon and wanted to get guided by the master will definitely go through this and make use of it, I'm sure, and it will be thought provoking for many of the homeopathic students. And I would like to extend this kind of lecture series and learning activity to a kind of a platform where we come and speak about organ topics, doubts when we where we clear. Definitely we'll be planning a free batch of organon for discussing in our app, so we'll have a batch where we can come and discuss ask doubts, so that it will be helpful for our practice and academic purpose.
No, that would be I'd be happy. I have already told. Outline I feel like instrument of thought. If it is creating a small fire of thinking, then the presentation is successful. Whatever presentation what we do. And I would like to tell again and again, even our teachers, honorable teachers, seniors, even myself, we can have mistakes. We cannot have this, what we say, dogma or sentiment of certain thing. Whatever I studied is right, and I cannot go beyond that. We should be open to discussion, and then we have the clarity. So, if because it's the same thing. For example, a case of a chronic stress, the patient had a chronic stress, and they develop a skin complaint or they develop a joint complaint. This is a very common scenario, right? A patient having a rheumatoid arthritis, having a chronic stress like after death of the husband or somebody. Okay. So, so now under which classification it will come? Either it is a physical illness, or it is a general illness, or it is a mental illness. This will happen. And Hahnemann tell it very clearly. Almost every disease have a mental disease, mental faculty will be affected. But if the mental symptoms is what predominating, if she is going in a depression than the joint complaint, then this has to be treated first. Then we go to the physical. So depending upon the presentation, the classification itself will fit in. Same patient will go into different classifications. Okay. Same patient himself can go to the different classification according to the evolution of the presentation. It's not the nosology. It is always the clinical presentation we have to think. Then it will be more. Then when we see that way, it will be more beautiful, more practical, and we see the genius thing what is there in Hahnemann. That's what Hahnemann speaks about true natural process. This is a very different, complex term. How we understand the process. This is what the whole entire world, right from Hippocrates, Aristotle, they are all are trying to understand the process of nature. Hahnemann tried it in his own way, and we will try to follow what actually Hahnemann did.
Thank you once again for this wonderful presentation.
Okay, okay. Thank you. Thank you for the time.